Sciatica, that shooting pain that goes all the way down the backside of the butt and the backside of the leg, is most often caused by something called a herniated disc. Now, to really show you what that is, in our spine, we have bone, disc, bone, disc, bone, disc. That's how the spine is organized. However, with those discs, if they're not fully intact and there's an issue with them, they can have something called a herniated disc present. So in this spine model, that's this red thing right here. It's actually a part of the disc that's protruding outside of the normal area. It's a lot like a jelly donut in that there's a jelly part of the disc in the inside and there's a more fibrous part on the outside. But when that fibrous part is weakened, the jelly comes outside just like it can in a jelly donut. That's exactly what's happening here in a herniated disc. Now, when we have that herniation, that puts direct pressure on those little nerves that are trying to come out of there. Those are the nerves that form that sciatic nerve and go all the way down the backside of the butt and the backside of the leg. So what we really have to look at is what causes that herniated disc in the first part. Well, one of the big causes is an abnormal curve in our low back. So in this spine model, we have our neck up here, we have our mid back here, and then our low back and our hips. This is about the normal curvature that we should have from the side in our low back. So again, this would be from the front, this is from the side. This would be the normal curvature. It's about 45 degrees. However, if we had a really big curvature, something like this, you can see in this model here how that puts extra pressure on these discs. So there's all sorts of extra pressure being put on the back side of the discs, and that forces those protrusions forward, and that can form something called a herniated disc. Now, the opposite can also be true, is that if we have a straightened lumbar curve or a straightened low back curve, that can put direct pressure on the front part of these discs, and that can cause those protrusions out back this way. So either way, whether it's more straight like this or whether you have a really increased low back curve, it can definitely cause those herniated discs. So you have to make sure that that low back curve is right at about 45 degrees where it should be. Now, one of the best ways to find out what your low back curvature is and if that could be the cause of your sciatica would be to get a set of x-rays taken. So we can do those at Deep Roots Health Center. It's where we help all sorts of patients with sciatica. It's one of the most common symptoms that we help. But if you or somebody that you know is dealing with sciatica, make sure that you comment, tag, or share below, and I will catch you on a future video.